Patrik Laine of the Montreal Canadiens leaves the game after a knee-on-knee collision. Welcome back, everyone. My name is Dr. Stefan Wilson, and here on this channel, we break down the mechanism of sports injuries. So if that's the type of content that interests you, then please consider liking and subscribing. Tonight's game has the Leafs at the Montreal Canadiens, and what we're going to take a look at here is Patrik Laine, number 92 of the Montreal Canadiens. He's coming up the left wing here. He has possession of the puck. He's going to come over the blue line, and that's where the contact is going to be made with the Leafs defenseman. It goes kind of quick here. We'll roll it back, and right there we can see the Toronto Maple Leafs defenseman, his left knee, making contact right there with the left leg of Patrik Laine of the Canadiens. We can see how the Leafs defenseman, his knee is making contact pretty much right on or slightly below Laine's left knee and bending it even backwards into what we call hyperextension just a little bit. When that happens, that is going to move his lower leg, his tibia, that's going to come forward in proximity to his left femur. When that happens, that's going to stress the soft tissue ligament in the back of his leg, in the back of his knee here, specifically called his posterior cruciate ligament, or his PCL. Of course, his anterior cruciate ligament, his ACL, can also be affected with a play like this. It takes a lot of force and a lot of impact from the Leafs defenseman in order to induce motion like that in Laine's knee. We'll keep going here, and we're going to see it from a different angle coming up here. This will show it from behind. We'll watch this one more time, and there's the contact, left knee onto left knee, and that is going to bend Laine's knee going backwards. That's going to stress the ligamentous attachments of Laine's knee joint. Now we'll watch the replay from behind. This will give us a different angle of what's going on to Laine's knee. We see the impact is just about to happen here. The Leafs defenseman, his left knee, is going to make contact with Laine's left knee, and it's going to cause a very awkward bend here into Laine's knee. Now we can see the angulation of Laine's lower leg in reference to his upper leg, his femur here. Now, pretty much that's not normal. This is going to cause a significant amount of tension and pressure to the inside of Laine's knee here. This will stress his medial collateral ligament, his MCL. Certainly the soft cartilage going through there, that's his medial meniscus. And even from that impact of knee on knee or knee slightly below knee, right onto the bone, the proximal, meaning the upper portion of his lower leg, his tibia, that can certainly cause what would be even a fracture at this point, a tibial plateau fracture. And of course, with this type of impact, there will be bruising, there will be multiple contusions to this area here. We're going to take a closer look at the anatomy portion here. So we're going to correlate what we're seeing with this angulation of his leg and how that actually looks on the anatomy screen. So we're going to flip to the anatomy screen. So here's the anatomy screen here. We're taking a look at a left leg. So if we can pretend, if you can imagine, you can picture this being Laine's left leg. We can orient ourselves with the pelvis up here at the top and the long thigh femur bone right here. We have the kneecap and the patella, the shin bone of the tibia, and its helper bone there, the fibula, and then down into the foot and ankle here. So remember what we saw on the play, the first replay, Laine was coming across the blue line, and the impact from the Leafs defenseman came from this direction right here. So what that did, that would stress the back portion of his knee, mainly his PCL, possibly his ACL on the inside, and making a lot of contact with what's called the tibial plateau of his lower leg. So that same impact on Laine's knee, we'll look at it from a different angle here. This is from the front of the knee. So we'll just zoom in a bit here. Again, thigh bone on top, shin bone on the bottom, kneecap, the patella right there in the middle. So the Leafs defenseman, again, made contact with his knee, but it also pushed his knee from this angle right here. And when that happens, that is going to really stress and tension all the connective tissue, mainly his MCL, his medial collateral ligament on the inside of his knee here. And then, of course, his ACL, his PCL are going to be affected. And remember, we talked about that the soft, spongy cartilage acts as a bit of a shock absorber through the inside of his knee there. That's his meniscus. That can also be damaged when this type of force is applied to knee at that angle. And the last thing we would take a look at, remember the shin bone here. This is the tibia, and mentioned there could be what's called a tibial plateau fracture. That would be through the bone right about there, possibly even a little bit higher there. The plateau of the tibia is the flat upper or proximal part of the bone here that makes up the bottom part of the knee joint. And the impact to Laine's knee occurred pretty much right about here, and that can send a fracture right through the tibial plateau. All of those injuries are certainly possibilities of what Laine experienced tonight. It could be multiple injuries that will be reported here in the near future. Hopefully Laine is doing okay. I hope we learned something here tonight, and please take care.